Welcome, everybody. Welcome, welcome. Welcome to our, well, this is August 2026 when we're recording this, but welcome whenever you are watching this replay to the Guiding Bright Minds free parent webinar series of empowering parents to support OCD recovery. I was just talking with our co-host prior to this that this is a topic that I'm very passionate about. So I'm excited that we get to share some of their insights with you all, as well as just giving you a space to ask questions. So as we're going through this, feel free to ask Ashley questions. You can put that in the chat or the Q&A. If you are watching this as a recap, you can also put questions in the description below. And so, Guiding Bright Minds, as many of you know, we are a free online resource for parents of neurodivergent children, caregivers, and their families. And really, our vision is we envision a world where neurodivergent individuals are recognized, valued, and supported, where their strengths are celebrated, their differences are met with compassion, and they have every opportunity to thrive in school, work, and life. And today we have Ashley Metz with us from Rogers Behavioral Health. For those of you who don't know about Rogers, they are actually nationwide. So whether you're representing here from Colorado or if you're in another state, Rogers Behavioral Health is a nationally recognized nonprofit provider of mental health and addiction services. Rogers offers evidence-based treatment for children, adolescents, and adults experiencing OCD, anxiety disorders, mood disorders, depression, trauma, PTSD, eating disorders, and addiction. And we have Miss Ashley Metz with us today. She is an LPC. She's a licensed professional therapist, also a therapist too, which I think means something in Rogers. Ashley has been working in OCD treatment for 8 years. So actually specifically used to work in residential treatment for 8 years. And my goodness, as a former director of admissions, I commend you, as I said, because that takes so much love and time and patience. So bless you. And you've worked with individuals across, it sounds like, the lifespan with OCD as well as parents. So welcome, Ashley. Thank you for co-hosting.
Hello. Thank you so much. I'm super happy to be here. Like you, also have a huge passion for OCD in general. Myself, do not have personal experience with the disorder, but anxiety very much so. And there's a lot of similarities. Anxiety is very much involved with OCD. So, and yeah, being in residential treatment for 8 years, it was a lot of work, and I just fell in love with the population, the work we do, and the progress and success that can be made with the right treatment. As we know, OCD, or I'm sorry, mental health is being talked about in society more than ever right now. And I'm sure my algorithm is very much biased to OCD, but I'm seeing OCD everywhere online these days. So I think this is a super relevant topic because it's a super misunderstood experience. I have worked with some of the sweetest, most special kids and adults that suffer with this disorder who have some of the most amazing, brightest minds that I've ever met that are just so disabled by this really debilitating disorder. So I've got a ton of slides where I'm going to talk about it all, talk about the family's role in the process and how parents can support their youth with OCD is applicable to most anxiety disorders as well. And I would say applicable to family members beyond just children. This could be applicable to a partner with OCD, a sibling with OCD as well. So good stuff in here.
I so appreciate you saying that. While you're pulling up your presentation, I think that's such a good reminder too, that, right, like this is a parent webinar, but this is really for any human being that is in relationship with somebody who may struggle with one of these disorders or challenges. So that's such a good reminder, because it's like at work, family functions, you are going to encounter individuals, and how do we support them?
Mhm. Okay. I will say I even apply a lot of these principles with myself and my own anxiety. I'll talk about more about that after. But okay, you guys can see my screen?
Yes, totally
Yeah,
can
okay.
see it.
Um, So, welcome. Today, we're going to talk about my goal for this presentation for you guys is to really have some basic concepts, um, understanding of OCD and its treatment modalities, the impact OCD has on the whole family system. It is a very internal disorder for the individual, but there's a lot of behaviors that can really take a hold on the family. Talk about family accommodation and identify ways parents may unintentionally reinforce OCD, and learn some new strategies that are more in line with supportive parenting that are not reinforcing the disorder. Um, Parenting is hard enough. I will say I did move from the East Coast to Denver just this year to be closer to my family. My sister has two little ones, toddlers. I'm not a parent myself, but being here this year, so in it deep, I can see. I just have so much respect for all the parents out there. The regular parenting challenges involved in your day to day life, being ready on time, leaving the home in a smooth manner, monitoring screen time and what's quote unquote right wrong for a kid in their developmental stage, normal family relationships, getting homework done every day, making sure your kids are socializing and learning how to socialize effectively. um, oh, my favorite, maintaining hygiene. That seems to be a huge headbutting opportunity for many of the parents that I've been working with these days. Um, Going to school every day. One thing I'm seeing as an anxiety OCD therapist, whether a kid has a mental illness or not, getting to school is very anxiety provoking and overwhelming these days. Um, and then maintaining sleep hygiene amidst all of this. Oh, and extracurriculars, etc. There's just so much we're already taking care of. And then when you add OCD into the mix, you see anxiety, worry, lots of time spent engaging in repeated behaviors or rituals, lots of question asking. I see this a lot with youth, especially. Of course, emotional dysregulation, which is common for kids and teens, of course, but when anxiety and OCD is involved, it's amplified. Intrusive thoughts, a need to seek reassurance from our family members, often demands that are influenced by the OCD, conflict, arguments, oppositional behavior. Sometimes OCD can really present as behavioral challenges. And I said before, it's such an internalized disorder in a lot of ways, the obsessional piece, which we'll get to more. Our kids don't know how to express or understand what is actually happening internally, which is why it can present in these more external behaviors, dysregulating behaviors, because they're also trying to learn how to regulate and express emotions as well. So, talk about what OCD is. Um, don't know how aware everyone in this group is, so I'm just going to hit as much as I can around the basics. OCD is characterized by two main categories, criteria: obsessions and compulsions. Obsessions are unwanted and intrusive. They happen internally. We most often call them intrusive thoughts. However, they can also present as intrusive images, intrusive bodily sensations, urges, doubts. We see a lot of doubt, doubt, doubt. Um, and these intrusive experiences trigger a lot of distress. So they're unwanted, they're intrusive, they're repetitive, and they cause distress. Compulsions are what the individual does in response to that intrusive thought. So, a repetitive behavior with the purpose of alleviating that initial worry, distress. There's this cycle that we'll go through. Um, Another big factor of OCD, because a lot of us have kind of tendencies. I know as I worked through like grad school, I noticed more perfectionism showing up in my work more and more. Um, what makes it a disorder, however, is the amount of time that is spent engaging in these thought patterns and behaviors, how much distress it causes, and how much it interferes with your functioning. So, while these perfectionism behaviors may have been showing up through grad school, I was still turning my assignments in on time. I was still going to work every day when I was scheduled, etc. I was still functioning. 2 to 3% of the population is affected by OCD, pretty high number. And on average, I believe the average person, it takes 14 years, maybe 13, to actually get an accurate diagnosis. So many young people are in therapy for years, 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 and they nor do the therapists realize that OCD is happening. And
That's
this,
incredible. Sorry to interrupt, but 13 years is the average amount of time?
I think there's a couple reasons for that too. One being lack of understanding and awareness of OCD, even in trained professionals. I personally didn't really think I heard and read about OCD in grad school, but when I walked foot on residential treatment campus, I was like, holy, this is not what I thought. So it's just very misunderstood. And again, it's very internal. A lot of people struggle. We talk about compulsive behaviors, but there's also mental compulsions that go hidden for a very long time. And we'll get to those more in a bit, but it's so internal that people don't even realize like it's a problem. It's become part of them. Um, and then, of course, there's a the IOCDF is working really hard to increase access to training in OCD because just not enough people have access to the education. Um, so common OCD themes. OCD can latch on to anything, I will say. Um, Actually, OCD tends to latch onto what we value the most. Um, but some common themes that we see in try to group themes into are contamination. So a fear of illness, germs, feeling dirty, harm OCD, which could be a fear of harming oneself or a fear of harming loved ones, perfectionism and symmetry obsession, so things needing to be perfect or just right. Taboo thoughts, this is where we see a lot more of those intrusive thoughts and images. Um, this can involve anything from extreme violence to extreme racism, fearing you're being a racist, to extreme like sexual intrusive thoughts, really disturbing to the individual and really confusing. Why is this happening? Causing all of the distress and compulsions. Uh, Checking is a huge theme. You see it more as in terms of like compulsive behaviors. Um, OCD is a doubting disorder, so a lot of compulsions, the function of that is to ensure safety. So you'll see a lot of checking behaviors to make sure that the stove is off so the house doesn't burn down overnight, for example. Um, and then scrupulosity. This is a term used to conceptualize both religious OCD and moral OCD. So we see OCD latched onto religion a lot. I've seen it more and more as I've transitioned into working with adults. I notice with kids, they're all like, F religion, social justice warriors, which I loved. But with the kids, what we did see more of was this morality OCD, which really means like, am I a good or bad person? Every behavior analyzing, does this mean I'm a good person or am I secretly evil, etc. So the OCD cycle, I referenced this earlier. This is like so important to treatment and understanding what's happening. you can essentially apply any trigger to this cycle in treatment. So starts with an obsession, an unwanted thought or worry, which causes anxiety. How I like to conceptualize anxiety is that the person is overestimating the danger of the obsession and they're underestimating their ability to cope with it. And because they don't think they can cope with it, they resort to compulsions. I also call them safety behaviors a lot, especially with kids. So these are behaviors physically or mentally to help create safety. So a mental compulsion might be reviewing the situation that happened yesterday to make sure I didn't actually hurt my friend, for example, to remind yourself I'm a good person. With that comes temporary relief, but in the long term, it's reinforcing that fear that that trigger is unsafe and I am incapable of handling it. And we'll talk about how to break that cycle. But first, an example. So this is an harm OCD example. The obsession being, what if I lose control, grab the kitchen knife, and stab my sister? Um, Anxiety is definitely increased. The person may stay away from their sister when they're in their home across the room. They may avoid the kitchen, ask for knives to stay locked up, even though they've never hurt a fly in their life. Monitoring how they're feeling towards their sister when their sister's around, reviewing the past to make sure they haven't hurt their sister in the past. Um, and again, in the moment, yes, they feel safe, but the next day when the sister walks into the kitchen with them, it's just even higher anxiety. And yes, as a millennial, I did put a few memes in here. I hope you all enjoy it. So, what does OCD feel like? Um, When this OCD cycle is triggered, it's really important to remember that your kid's fight or flight system is being triggered. That is the amygdala in the brain, the thing that was developed to keep us safe from saber-toothed tigers. So when they see a public bathroom with a contamination OCD case, they literally are viewing that as a saber-toothed tiger in their body. So, our work as therapists is to retrain the brain and retrain the nervous system as well. So, it feels like life or death, especially with our real severe cases. There's a lot of hyper responsibility. I have to do this to keep my loved ones safe. Um, they, we don't like uncertainty when we're anxious, so really low tolerance for uncertainty, helplessness, constant doubt, guilt, shame, a horror movie in the mind. I've worked with a lot of neurodivergent kids, in particular, ADHD, autism, who are very visual thinkers. So when you're having these intrusive thoughts about stabbing your loved one, for example, it can be really almost traumatizing to some kids, depending on kind of where they're at in their life. So, and again, it's so internal. Our kids don't tell people this. So, what might look like annoying behavior, the kid can't get out of the shower in a timely moment, it's really important to know what it feels like internally for them. Because it's frustrating. Trust me, as a residential worker, I saw it. It can get frustrating because we care. We just want them to keep moving forward. Um, so, how do we like fix it? Exposure and response prevention, the gold standard treatment for OCD. It is extremely evidence based. It works extremely well and it's extremely challenging. When you're thinking of the saber-toothed tiger in front of you, we're asking our kids to literally face their biggest fears. It's hard work and it works. So exposure. That is exposing yourself to the feared thing, right? I will say this presentation is an exposure for me. I can talk about OCD all day in my work, but put me in front of a group and my anxiety increases. So I'm doing the exposure, right? The response prevention piece for my example might be I didn't review my presentation 20 times last night. I reviewed it once yesterday and once today because I know what I'm talking about. Um, with a more severe OCD case, you might see a kid up for hours rereading their presentation, what that's due to the next day. Um, when OCD impacts school, you'll also just see complete avoidance because it's easier to just not do it instead of even attempting it. Um, so there's the exposure piece, but there's also that response prevention piece, which is essentially stopping your compulsions, stopping your safety behaviors, so that your brain and body can learn that you're capable and that it's, I say this all the time with my teens and adults, it's not that deep. Some fears are, but the large majority of OCD's fears are not as deep as the brain makes them think they are. Really important to take small steps in exposure work, especially at the beginning. With our younger clients, it's even more scary to them because they just have the less context and awareness of the world than our adults do. So something might seem ridiculous to a 20-year-old doesn't to an 8-year-old, right? So really taking small steps. If the fear is spiders, um, I'm not going to ask somebody to hold a spider our second session we have. Rather, we might start by looking at a picture of a spider for a minute and then tolerating that anxiety, which we'll get more to in a bit. And with that comes courage and bravery. Um, this can be hard for parents too. We'll talk about it more, but we want our kids to succeed. We want them to be safe. We want them to have everything we didn't have as kids, right? And do better. And a lot of times, what comes with that is them not learning that the skill and their capabilities. So, kind of stepping back as parents can be really, really challenging. So, ERP retrains the brain over time with repeated exposure. Anxiety does decrease. It's called habituation. Um, Habituation is essentially a peak and a fall of emotion. So when we're washing our hands over and over to reduce our anxiety, we don't let that natural peak and fall actually happen. So with exposure, by reducing the compulsions, our body learns that emotions do peak and fall, and it happens less intensely and over shorter time with the repetition. All right, now let's talk about your guys' role. Um, Family accommodation. This is so, so important, especially with kids. The basic concept of this is when you, a parent or a sibling, changes your own behavior to meet the OCD's needs. Um, Large majority of the time, this comes with very positive intentions. Like I said before, we just want to help and get through the moment. Um, but in the long run, it does contribute very harmfully to the OCD cycle. And this can create a lot of guilt and shame for parents as well. When they first realize, like, wow, everything I've been doing for the last 5, 10 years, however long, has actually been harmful. Um, and I just really want to validate and normalize that. Um, I always tell parents, you have always done exactly the best that you could with what you've known at the time, right? So I hope you take this information and use it intentionally going forward and give yourself some self-compassion and grace. Um, so the accommodations do reinforce the belief that your kid isn't capable, and I know you guys don't think that. It supports the disorder and not the recovery. And yes, these slides I'm happy to send to you. Um, so what does accommodation look like? It can look all sorts of different ways, but um, one, doing rituals with them. So checking locks with them, bringing them back home to make sure their room is a certain way, even though you already left the house. Um, Listening to excessive confessions. A lot of people with OCD really, on one hand, it's internal until they find a safe person, and that safe person, it's common for them to know literally everything, and that could be a parent or a therapist. Um, we call it confessing because when you look at the underlying function of sharing every single thought you have, the person is typically looking for some reassurance that they're not crazy for having these thoughts. So giving them the space to like verbally ruminate can actually really just be harmful to the OCD. Altering your family routines, whether it's cooking a different dinner every night for your child relative to the rest of the family. Repeated reassurance is a huge one we see with kids. Um, if you hear a what if thought and your kid has an OCD diagnosis, that is likely something you should not be engaging with. Um, can become a fine line. I believe there's a slide on information seeking versus reassurance seeking, but just notice when it's a repetitive question over and over. And we'll talk about appropriate statements too. If you're eliminating triggers for your kids, that in the short term really alleviates a lot of stress, but again, contributes to the cycle. Um, I currently have a young adult actually who his parents have almost every house in the door locked up to prevent him from going in while sleepwalking and ruining something essentially. Um, a perfect example of how you can help avoid triggers by doing these things. And then providing compulsive items, things like buying 20 bottles of soap a week for hand washing is a huge accommodation and really harmful to the family, I'm sure, from a financial standpoint, emotional standpoint, right? Um, all right, so we're going to pause. I'm curious for you all to take a moment and consider, I guess maybe type in the chat is probably the best way to go. What are some ways that you might accommodate in your family? And what are some reasons why?
Ooh, yes. So in the chat or in the Q&A, feel free to respond. Even as you're talking, I would be curious. So when we're talking about accommodations, and maybe this is for a different topic, or maybe you have it on a slide later, but with regards to body dysmorphia, I know we haven't talked too much about that, but that's a form of OCD. Um, I'm wondering how the accommodations for that are, if that's
Oh,
more of just like a reassurance around appearance or reassurance.
definitely. You see a lot of reassurance seeking with appearance. Does my outfit look okay? Um, on social media, you'll see a lot of compulsive behaviors with teens, especially like constantly retaking photos, reposting, checking who looked at it. I guess that's not a accommodation though. An accommodation could be not taking photos of your child. I've seen that a lot.
Mhm.
Children who won't go out in the daylight and will only go out with their family at night because they're less likely to be seen in the light, things of
Mhm.
that nature.
That makes sense.
Oh, and like covering mirrors, big one.
Okay, that makes sense. We have a couple others too. So somebody's taken the training to prepare. They don't have a child, an OCD child at the time. Great, welcome. Hope this is helpful. And then adhering to their cleanliness requests around the house.
Yeah,
Yeah.
big one. Whether it's like preparing food, how often you clean, what you clean. Some kids might say, you're not allowed to go in my room and clean. I'm the only one allowed to clean my room. Good example.
Yeah, great example. And I love the awareness too that says doing this to ease their anxiety and
And
keep
keep
the peace. So yeah, give yourself some grace and know you're not alone.
Yes. And I'll say, especially in residential, even I was accommodating a lot. Like, you can't just stop it all, right? Some moments you have to keep the flow going of the family, and that's okay. As long as you're working towards the reduction and having these conversations with your kid and their therapist as well. Oh, where'd my button go? Sorry. So, similar to the OCD cycle, there's a family accommodation cycle. Essentially, that accommodating behavior that you've identified or are thinking of does provide that temporarily relief, but it also causes your kid to rely more on it. Um, we see this a lot with my nephew sleep training and sleeping in his own room. As soon as my sister started letting him in again, it was like a snowball effect of wanting to be in there, afraid to be alone in the dark, which is normal for a 4-year-old, don't get me wrong. But if that escalates, that reliance, it happens quick. And it all ultimately maintains the OCD. So, what can you guys do? Couple things to say first. It's important to be very collaborative with your children around these shifts in how you're parenting if you're going to make any changes. You never want to eliminate or reduce an accommodation without telling them first. That will only lead to more dysregulation. You want their consent, just like me as a therapist with exposures. I'll never do an exposure a kid doesn't want to do. I want their at least somewhat willingness. As a parent, you have a little bit of more authority, right? This is what's happening. This is how I'm going to start responding, but you want them to know first. Um, some strategies to use externalizing the OCD. We see people so attached to their OCD, and my job as a therapist is to help people learn that you are not your thoughts. You are not your OCD. You are a whole different person. Your OCD is trying to get you to do something else. So, really externalizing the OCD, whether it's just like naming it, is this OCD again? Or literally naming it a name, is this Sally again? Again, being collaborative with your kid to help really start separating. Um, Doing the opposite of what your kid is asking you to do. So I like to get sassy with this a little bit, to make it playful. You don't want to be rude and say, no, I'm not going to let you shower, but kind of bring some humor into it. Let the kid know, like, is this really helpful? Be playful. Really incorporating your child's interests is going to go so far, especially with more creative neurodivergent minds. Um, we talk about values a lot and hobbies and interests. And if the exposure involves something that you truly care about, you're going to be more willing to do it. If the reduced accommodation brings them closer to something really cool they're interested in, they're going to be more willing to do it. Um, be patient is probably my biggest one for you. Um, this is a long process for a lot of people, especially for young kids. They're learning how to navigate the world. Learning how to navigate OCD takes time. And there's this phrase, treatment is not linear, but it's so true, no matter how cliche it is. The ups and downs in OCD treatment can be significant. Um, I always say once we start pushing back in treatment, OCD pushes back harder, and you'll often see spikes in symptoms throughout the work. So I just want you to know that, be patient, celebrate small wins, especially with kids, even adults. My adults love it too. The little things. We as individuals don't see the small steps we take on a day to day basis. We're always looking for that longer term goal. I want to feel better. Well, what does better mean? And how do you know? And even if it's a 5 minute less shower, that is huge. We just want to do anything to break that cycle. So, really keeping that like excitement and praise going is important because it's exhausting. So, um, use calm language, keep your routine steady. If you do identify an accommodation you want to reduce, like we're leaving for school by 7 a.m. every day, stick to it. Um, Even if they're having a good day, good week, don't loosen up. That consistency is so important for these really rigid brains. Um, in model bravery, be brave with them. I always tell my clients I will never do an exposure or I will never ask you to do an exposure that I won't do with you. And actually, yesterday, that one that just discharged, we had Dunkin' Donut munchkins. We put them on the community toilet seat in clinic. We cheers each other and we popped them in our mouth. Did it right along with her. So don't be afraid to step outside of your comfort zone. As an OCD exposure therapist, I've really learned to live my own exposure lifestyle, which is something I preach to my clients. We're not just doing exposures in clinic and therapy, we're approaching life as an exposure. What is there to learn from approaching this trigger? What confidence can I build? What skill can I build? And back to giving yourself grace, getting your own support is probably some of the most important steps you could take, especially if OCD is really taking over the family. Um, at my previous job, we had an excellent parent coach who was just incredible. And she used to always talk with parents about post traumatic parenting when they get their kids to treatment because for so many families they're like living in crisis survival mode for like a long period of time when the OCD really snowballs. So um just acknowledging that like yes, your kid is sick and needs support and can get better, but you need your own support too. That's okay. What does my sister say? It takes a village, she always says, to be a parent, and that's so real.
So,
Um,
so true. Oh my goodness, so true. And I just, this is resonating so deeply. I can tell with several of the folks in here and that piece. It's like for if you're a caregiver, if you're a parent, like I hope you can hear this slide and I hope it's echoed to you that you do. Sometimes that's the hardest step, right? Is to take care of yourself. And if you are walking this journey with your child, it should be a prerequisite because you deserve to. Anyway, my
right.
PSA is done, but I just had to say that.
Yeah, and I put this here lies my need to people please on this slide because I think like parents want to do their best to help their kid, like I've said, right? And it's okay to have your own boundaries. Actually, it's really important to model that, I think. So just remind yourself of that. Um, Pull in your people, find a therapist if you need to, go to a support group, just connect with people who get it. Um, there's no support from anyone in my life. What do you suggest? It's a great question. Um, I would definitely start at the IOCDF.org website, the International OCD Foundation. They have a plethora of resources, including an amazing treatment finder, which even includes support groups, virtual, they have insurance filters, all of that. A support group would be a great place to start, though, just to like hear more about other people's experiences. Even with my clients, we ERP is very group based, in my opinion. It works best in group versus individual because I can't connect with them the way that their peers can. So many people feel like they're so alone in this. So just getting in a group and having a space to talk can be really valuable.
Absolutely, and the fact that you're here today, I just wanna reflect that,
Yes,
right?
yes.
I acknowledge what you're saying that there is no support, right? And that from anybody in your life, and give yourself some credit. I'm gonna challenge that thought that you showed up today, and not only did you show up, you just asked a question. So, I commend you, and yes,
Yeah,
I echo what Ashley says. I've gone to that conference before as well, and they are
they're
phenomenal.
awesome. Yep. But yes, education is the first step, I always say. So I'm happy you're here as well. Supportive statements. You know, we talk about OCD demands in two kind of categories, I guess. Or I'm sorry, OCD parenting in two categories. And that often looks like being super overprotective in response to the OCD or being over demanding. So that's the super accommodating or the super, I'm done with this. I can't do it anymore. We want to parent a little bit in the middle, right? Balance some of that, like I care, empathy side with, and you can do this boundary side. So, acceptance plus confidence equals support. Validating how your child feels and how hard this is, expressing how confident you are in them and that you know they can cope with the distress. We want them to sit in some uncertainty. So if a kid is really distressed, seeking reassurance, are you sure I didn't hurt my baby brother? Are you sure? That response might look like, I see you struggling with this worry right now, and I'm confident that you can sit through this pain and allow it to pass. Um, I will sit here with you, for example, rather than, yeah, of course, no, you didn't hurt them. Very different responses. A couple more slides and then we'll go to questions. So again, unhelpful. Yes, you're totally fine. Reassuring, reinforcing that OCD. Helpful response might look like, that sounds like OCD talking. I know this is hard and I know you can handle this. Um,
That's such a great, I love that. Right? Because that leaves us in that empowerment state. It's like and right, like the for those of you that are familiar with DBT, right? Like both can exist. This can be difficult and I can do hard things.
that's what we want our kids to do, right? So I'm going to put it back on you guys. Um, is there a time, if anyone's willing to share, maybe in the past month, that your child felt really distressed, acted on anxiety, and how did you respond in the moment? Would you say it was more supportive? Would you say it was more accommodating? Can you identify a time you were supportive? Give you guys a second.
Yeah, so feel free to include that in the chat. I mean, like, even as I'm thinking, I like you, I have a niece and nephews, and there have definitely been times as you've been talking that I can hear interactions with them where maybe they came in with just so much intensity and almost like borderline anger into a family situation where it was like, this is positive. We're about to share a meal. We're about to have this great time. And I met them at that place. So they were elevated and reflecting. I met them high up of like, what's going on rather than actually, because you're saying, how can we rewrite this? Staying calm, I feel like, and just leaning in and asking, hey, things feel like they're off today. Is everything okay? Rather than just being like, what's your problem? Because I was then elevated, if I'm following you correctly.
Absolutely, yes. That pausing and I mean, we react to energy. It's natural, right? But taking the time to pause and just think before we speak and regulate can go such a long way for how the other person regulates. Um, oh, it's okay. It's okay if nobody has any examples they want to share. I do want to leave some time for questions. Um, this is my last slide to open that up. Know that OCD is never satisfied. No matter how much you give, it's going to take more and more and more. And it's a hard cycle to break, but it is doable. So, anyone has any questions, I'm super happy to answer.
Ah, thank you so much, Ashley. That was just so wonderful, and I feel the perspective that you bring, not only is it clinical, but like you've said, your experience is firsthand and really just walking this with them. So thank you. This is such a straightforward, real talk about OCD, but also with so much compassion, and I appreciate that. I so
Don't be
so
afraid to get your kids help, really. I I mean, working in residential, I've seen some families really devastated at the decision for their kid to come stay with us in New Hampshire for 3 months. Um, but even some of the most trained professionals out there don't know how to treat this the best still. So, God forbid a
Mhm.
parent would know. The help
Yeah.
is out there. Just got to find it, seek out the doctors, seek out the resources as much as you can.
Yeah, absolutely. And so from your, and I put this in the chat, and if you're watching the replay, we'll make sure that it's in the description, but the International OCD, is it Federation?
Foundation.
Foundation. So iocdf.org. We have put it in the chat. It will be below. So if there are individuals who just have no idea where to start, just kind of feel hopeless or helpless in the regard of their journey with OCD, is this a good website to maybe start?
Absolutely. Not only do they have resources in terms of like education about OCD and what it looks like, but also so many treatment providers listed on their directory for free. They have like weekly live webinars on YouTube that stream certain times of the week that involve therapists and people with OCD. Just so much there.
Wow, that's incredible. Thank you so much for sharing that. And then we do have somebody asking, it would be helpful to have a sheet of common unhelpful responses versus helpful responses. Ooh, I love that. Yes, right. Like it's good to know what to say and also what
What's
not to
not?
say.
Yeah.
Yeah.
I'm happy to get that to you guys along with the slides.
Perfect. Yeah, I love that. So thank you so much, whomever that was that asked that. That's such a great point. And yeah, we'll put that in. So everybody who RSVP'd for the initial one of these will get all of this sent out. And like we said, we'll put everything in the comments. And it looks like yeah, how so 14 years is such a long time for people not to get diagnosed, right? Yeah, so that's kind of a question, like, do people give up? Do they just, hey, this is just who I am?
Yes. I mean, we see so much like depression come secondary with OCD because life becomes so small. They feel so misunderstood. Um, it's easy to feel discouraged and defeated, which is why it's so important to find a support system if
Yeah.
you can, to help just mitigate and move you through. I do see all the time once somebody is in OCD treatment, treating their OCD effectively, that depression will
Mhm.
go like that. It's discouraging. It is, and it can be hard to find the people to connect with, and it can suck to do it virtually, but it's a place to start. It really is.
Yeah. And I will speak transparently. I was sharing a little bit with Ashley prior to us getting started that I have had my own personal OCD journey, and I'll share this for the sake of sharing it for the group. And yeah, it took a very long time for individuals to really kind of understand, and for myself. So if there is anybody on this call or watching this replay that kind of feels that way, right? Like how do people actually get help? I would have never thought in a million years that I was struggling with something like this. And I definitely hear there's somebody in our chat who's talking about, hey, I don't have insurance. I don't have this. Like so much is going on in life, and I just, I'm only one story. I know there's others, right? And obviously, Ashley, you've shared a lot about your clients. I just think it's critical that we have to advocate for ourselves. And had I not, yeah, just continued to trust in what I was reading by the experts and what I was being told by experts that, I may never have gotten help. So, for those
Mhm.
parents or caregivers or just individuals that are on this, yes, obviously this is to help our children, this is to help the kids, but also any of this reflects back to us as well, right? So us getting that help, because we're not helpless and we're not hopeless, even when on the days we feel like we are.
Mm, I know the shame can really contribute to withholding the yucky thoughts and feelings that are we're having, whether it's OCD or not, right? But it's just so important to be open with a provider so they can help you. I worked with somebody for like 6 months and before they told me what their main obsession was because they were just so ashamed. It was very taboo in nature, but it's a huge step. And I love what you said about trust. Trust the process. It's really hard with anxious individuals to trust. It's like against our nature, but um,
Very, very true. Yeah, great questions, everybody. Anybody else? I will, while we're waiting for that final one, you brought up a slide about the OCD cycle, and it felt like I can't remember the example that was used in that, but it seemed like it made so much sense why it's so misunderstood. Because even as you're sharing all these things about OCD, there's a lot of co-occurring behaviors or other things that may go unnoticed, right? So it's like, wow, maybe somebody was diagnosed with ADHD and thought all of their challenges were simply falling under that umbrella, where there may be other co-occurring issues.
yeah,
So I'm just curious, do you notice, if is that common in your work?
absolutely. That's actually a big contributor to the length of time before an accurate diagnosis. There's so much overlap with so many different things. I mean, you think of an obsession and an intrusive thought. There's also intrusive memories associated with trauma, right? Anxiety shows up in all sorts of different things, of course. Behaviors, though, particularly, um, kids can get labeled as like a bad kid because they're refusing school, because they won't stay in class because they really need to get out of here to wash their hands. And again, they just don't know how to communicate it. And it leads to assumptions about the behavior. So that like compassion, calm, and patience is really important here, right? Being calm, creating a system for your child where they know you and their treatment team are understanding and here to support them and will meet them where they're at until they're ready. That's what goes a long way with children, especially.
So true.
So many repetitive behaviors with autism too, right? And that a lot of actually, I see a lot of times people who actually have autism being diagnosed with OCD as well. So
Yeah, I've seen that definitely in the admissions process with some families, and it's like a light bulb, for a lot of times, like, this makes so much sense.
yeah, yep. Well, I'm happy to be here and educate.
Totally. Yes. Thank you so much. So, if we don't have any other questions, that is going to be a wrap. So, one thing we will say, so if you're watching the replay or if you're on live, we will make sure that you get the what to say and what not to says. We will make sure that you have access to the slides, and then the International OCD Foundation, iocdf.org is below, or it is in the chat. So thank you all so much for joining us today, and we hope to see you on one of our next ones.
Bye.